So we're going to jump off with imagery, how to use imagery with psychosis. I just love this stuff. So when I write about this stuff, I go way overboard. And I found several programs or protocols, I guess we want to say, that help us to really use imagery with our clients. And we could see some absolutely tremendous results with that. So the first one is Aaron Beck's model, and Anthony Morrison actually did some studies with Beck to see if their protocol works very well. There's one called IMAPS. Well, first, Aaron Beck's is about using imagery to uncover beliefs, okay, those deep core beliefs. IMAPS is one that's very similar to Beck's, but its goal is to uncover more underlying beliefs about self. So CBTp and IMAPS is very similar. Imagery rescripting is a very interesting one where we actually, us as therapists, enter into the image that we're working with and play kind of like a role model until the client can enter the image, him or herself, as an adult and take control of things. And EMDR, we'll say very little about that because I don't know how many are actually certified, but EMDR has a lot of imagery in it. And then we have one last one, an imagery protocol to enhance future directed thinking. So this is for folks who are predicting that catastrophes will happen all the time. Today, I'm going to center on the very first one. There are some protocols written out on the slides, and I have included the imagery rescripting for psychosis. I think that's it. Maybe it's the IMAPS. At any rate, let's jump ahead here. So if you remember, decades ago, we talked about emotion regulation, and the way that we do that is either to reappraise a situation and become, have a more reality-based thought, or the other way is to avoid the situation and works in the short term, but gets worse as time goes along. And so in order to reappraise something, we have to change the underlying belief with which we walk through the world, right? And so we can use imagery to uncover those beliefs. That's why this protocol is for that specifically, to underscore that. This was a study. All the participants were having cognitive therapy. They could all identify images that occurred along with their psychosis symptoms. And so if they were able to bring up the image and talk to us about it, that's what we're hoping for. And, with clients who are terrified of talking about the image, then we just go very, very slowly and introduce to them what the purpose is. We should do that before even we start this protocol. So they're asked about the content, and we do some guided discovery with that. Some of the questions include, are the images connected to the kinds of symptoms that you're having? And is it connected to a specific memory or belief? Do they recur? And do you remember feeling the same way that you feel when this image comes up that you felt sometime earlier in your life? So these are all questions that are trying to connect the image with an underlying belief, and emotions, I'm sure, go with that as well, though we didn't talk much about that. So the way that we begin this imagery is to give them some education about it, and then we begin to work very lightly with it. So we'll ask, can you remember a time when you were really happy or excited? Dwell on that for a moment. Can you see that picture in your mind's eye? Anchor that kind of within yourself. That's a great way to start any session, actually. It arouses happy feelings and relaxation. The next thing that we want to do is to have them attempt to manipulate a neutral image. So they talked about a green apple. Imagine a green apple sitting on your hand. Now, can you, and I would, if I were doing it, I would describe the green apple and the dew on the outside and, you know, the smell of it and all that stuff. Now, can you turn that into a red apple? And most people can do that without too much trouble. That part of it needs to be practiced pretty well until the client gets the hang of changing the image around of this neutral object. They did have homework, and that was to know any images that came along in between sessions. If the client was unable to produce an image, the memory was recorded and the image was just jotted down as no image was available. Okay, and see if there's any images that they can bring up that aren't necessarily connected with the psychosis as well. Because if we can get in that way, then the images may begin to show up for the psychosis. This is really why I like Beck's model the best. It's very complete. We help the client become used to dealing with images, and we can play with it a little bit while we're in the beginning stages of this. We can play with mild distress and see if we can even lessen the intensity of that more by changing the image. Or we can increase coping skills by having them see themselves as coping well. And there's different ways that we can use this to get different outcomes. So we can substitute the image. So that means, actually, some of the articles talk about incorporating humor in. And so a substitution might be, if the devil is coming at me, let's see if we can change that image to something really silly, like Clifford the Big Red Dog, or whatever, enjoying, you know, a cartoon, or dolphins, you know, coming at you in the water and flapping and having fun. Whatever they want to do to substitute that thing for the devil that they're seeing, or whatever it is that they're seeing, then we work with that, and we can help them embellish it. The other way that we can do this is to repeat the image over and over again. This is a lot like EMDR, for those of you who are not familiar with that. And it's basically imaginal exposure. And over time, the distress will naturally decrease, but a lot of people are not great with that. We can take the image and do some reality testing with it by just talking it through. I love this one, jump ahead in time. So once your client has some skills under their belt, but they're still anticipating catastrophic events happen, we can have the client see themselves using the skill in some future feared event, which is, I think, just really cool. And you follow that jump ahead in time all the way through the image until the client comes out free and clear from danger. So then we practice that over and over and over again. And again, we can change the image to whatever the client wants to change it to that might bring some, you know, joy or peace, or at least reduce the intensity. When we, you know, towards the end, we're having them practice over and over again. This is a lot like the nightmare protocol, if you're familiar with that, where they talk about a nightmare that they're having, and then they can change the ending of the nightmare. Have you guys heard of that? If you haven't, I can send you that protocol, but it's really cool. It works really well. So this is really about imaginal exposure. And once we get the client used to this and habituated to one image or one place that they avoid, then we can increase the range of places where they have fear of going, right? So it might be a coffee shop, it might be the grocery store, and we have them walk through those scenes using the coping skills that you're working on. As we're doing this, we take time to stop, process what's happening, and rehearse the strategies, or maybe tweak them if they're not working very well. The final sessions, and I love this, is reverse role plays, where the client plays the therapist and you play the client, and they help you to solidify your skills with a distressing image. So of course, we're not going to say the most distressing image, something mild, but we do that, something appropriate, and that really helps to anchor the skills. And it also builds collaboration and that sense of having a partnership. This imagery, imagery, is really much the same thing. So I can't imagine that the length of treatment would only be six sessions, and that would be complete. I would guess they had made a lot of progress in this study. And it's basically the same as the CBTP one we just went through. They did, however, say, let's be sure that when we're doing it, to work off that start menu. And so here we do the same thing, psychoeducation, we teach how to manipulate, we explore difficult images and reshape the image, find a different ending, use humor, replace it with something very, very neutral. And this is the one that I have attached to the PowerPoint that has the full protocol written out. Basically, what you're getting is an outline of the article rather than the article itself, but the reference is on there if you want to see that on your own. So look at these numbers for the outcomes with the protocol that I just described. 0.001, 0.015, 0.004, 0.033. These are significant differences in intrusion, voice frequency, the distress, and the malevolence of the voices. This they note is less robust, but holy cow, that's beautiful. That's under 0.05, so we're doing really great here. There happen to be 12 participants, and interestingly, one member felt she was significantly better prior to the end of the trial and left, and 2 other clients finished 1 to 2 weeks early because they had reached their goals. And all came back for doing their follow-up measures. Amazing. This by Pollock is expressly for post-traumatic stress disorder and psychosis. And I would urge you to look up this reference that's in the back, because for those of you who are dealing with both, this is a beautiful way to do it. What happens here is right before the horrible incident happens in the image, the client steps in and takes control of things. And you can do some pretty fantastical stuff with that. For example, giving the client a magic box that has, extra coping skills in it, or that has some memory of you talking them through something. Eventually, they bring themselves as an adult into the image and manage things on their own. But you get to model that with them in their memory first. And that's also a beautiful way to do that. Interestingly here, they started with the worst trauma event and worked their way down. So you might have them list a whole bunch of images and then put them in hierarchy and work with the worst and go down. So this is all written out here for you. Here are the outcomes. Again, you can see that intrusion, malevolent voices, distress, frequency, all drop incredibly with this kind of a procedure. EMDR, for those of you who are interested in certified, there are 3 ways to use that. Again, Vandenberg is really the specialist with EMDR and psychosis. And again, I would urge you to look that up and take advantage of the methods that he's using. Anything from the worst image to evidence against negative cognitions, or just even common things that come up for them. So here's some caution for EMDR. There really isn't much caution here, except for that as you're doing it, because people with schizophrenia or psychosis can have a flat affect, it's hard to tell if they're responding to it. So you may have to kind of stop and ask, and they may have some dissociative reactions. So grounding them, teaching them to ground would be the best. And here was a brief intervention that did a lot what Beck did, which is introduce a feared experience and have them learn how to cope with that through your processing, and then rehearse that image over and over again. Here's another one where we see positive cognitions went flying up. Neutral ones, they tried to work with neutral ones. That worked very well. Negative ones got more negative the farther away from the intervention they were, and positive images also increased at a significant rate the farther they were from the intervention. So you can see that the effect is not just outstanding, but it's outstanding in an enduring way. So there we have it. You've got all the references, and I would really encourage you to read it. It's just amazing to work with it, and it's a lot of fun because you get a lot of response from that very quickly. So there we have it. I know I went through that pretty quickly, and that's it. Any questions?